Well, it is that time of year when kids get ready to go back to school. I know that that's the case in my household. And as they're all heading back into the classroom, the CDC is out with new vaccination data. The number of children exempted from vaccine requirements was up to 4.2%. That's an estimated 155,000 kids across the country during the 2025 and 2026 school year. Dr. Michael Bingham is the Chief Quality Officer and Pediatric Intensive Care Physician at Akron Children's Hospital. Dr. Bingham, thanks for being with us. Tell us, how sizable is this increase in exemptions and how do they work?
Well, I think the increase in exemptions is material, right? The CDC is reporting that. And I think we think about the whole number, but then we also think about the individual children and their risk if they're unimmunized. And I think one of the drivers of that that's really been interesting to us is the conflicting information facing families and caregivers of these young children and how they are gaining the information to better understand their vaccination or immunization decisions for their child.
And we have up a list of some of the commonly required vaccines for children. What do they do? Why, in your opinion, are they very important? Are there any on that list that you think are critical that parents really need to make sure that their children get before they go into school?
Well, I think there's these are great conversations to have with a pediatrician or your trusted caregiver. The healthcare system is really committed to the health of your child, and I think for decades and decades, we've tried to meet families with their healthcare decisions for their child. And I think what we know is that any singular vaccine does a significant reduction in the risk of acquiring an infection. And moreover, we know that families are really challenged when facing the conflicting information that's out there, and they're not certain about what the right vaccines might be.
Right, and it's more challenging because vaccine requirements are set at a state and local level when we're talking about schools, and we've been getting some different guidance from the federal government. Earlier this month, President Trump signed an executive order calling for reduced immunizations for children. In my experience, all parents are generally trying to just do what's best for their families. This can be confusing. So what is your message to parents, especially because you mentioned you have this relationship with your doctors, but that's not the way that the healthcare system necessarily works for all families. They don't necessarily have this trusted relationship with their doctor.
Yeah, I think what we've actually at Akron Children's, we've tried to better understand families and their navigation of the information that they're facing. And I think what we've learned is they are getting an enormous amount of information, often quite conflicting. And what we know is that they're sometimes uncertain about the right direction, and sometimes even second guessing decisions they've already made as they're trying to navigate that journey. I think what we've learned is they have proven that they do trust their children's hospital. They trust their healthcare providers. And I think as folks are sort of engaging with all of the sources of information that's out there, I think what we've heard from families loud and clear is that their pediatrician is a great source to validate the information they've heard or help resolve the conflicting information that they're hearing.
All right, Dr. Michael Bingham, thank you.
Thank you.